Okay, perfect.
Hello, everyone, and welcome to Neurocracy. Today, we're joined by Dr. Hrayr Attarian, a professor in the Department of Neurology at Northwestern University and medical director of Northwestern Medicine Sleep Health Center. His research focuses on sleep disorders in refugees and its impact on quality of life, as well as health disparities in sleep medicine. Dr. Attarian, thank you so much for joining me today.
Thank you for the invitation.
So, what first drew you to study sleep medicine?
When I was an undergrad in college at the American University of Beirut in Lebanon, I took a course. I was always interested in psychology, so I took a course in abnormal psychology,
Yeah,
and they talked about dreams and etc. So I got really intrigued and went to the library and got some books and read about dreams and then I found out that there was such a specialty as sleep medicine. Since I was already pre-med, I decided to go to pursue a path that will eventually take me there. My path was sort of circuitous because I started residency a little bit late, and I had to go through another fellowship first. But long story short, that's how I got to sleep medicine.
interesting. So, I believe you'll have a perspective that can help answer this question. So, why do so many neurological disorders connect to sleep or maybe have some relationship with sleep disturbances?
Because as my mentor, the late Mark Mahold used to say, sleep is a brain function. So sleep is inherent in the study of sleep is should be inherent in neurology because it's a function of the brain, and any kind of structural abnormality in the brain or functional abnormality in the brain can disturb sleep and vice versa.
Yeah, that's a neat
Yeah.
answer actually. I like that. Yeah. So, I believe you've worked with refugees and a
Mhm,
lot of people who've been exposed to trauma. So, I'm
mhm.
curious, how does trauma uniquely affect sleep?
The trauma affects sleep in two separate ways, two separate but interlinked ways. One, the most common situation with trauma is that trauma will make you hyper aroused, right? So it will, as a defense mechanism, your inherent fight or flight response is uh, uh, cranked up a few notches because
Yeah.
you're always, you have to survive. And then that hyper arousal of the brain persists after the trauma is gone.
Okay.
Okay. So that is not conducive to sleep. So it
Yeah.
disturbs sleep that way. And the second is trauma can also lead to severe nightmares where people relive the trauma, and that can be a secondary cause of disturbance in sleep. And then people have this anticipatory anxiety about going to sleep because they don't want to have the dreams. And
Yeah. So, recently, actually, on the podcast, I was speaking with someone about how sleep is related to death of locus coeruleus neurons. So, I'm curious, do you have any like connection in your research with those like fight or flight neurons kind of in that locus coeruleus area?
so it's not sleep that's related to death of locus coeruleus
Okay.
neurons in animal studies. Sleep apnea
Oh,
or the intermittent drops in oxygen levels
yeah.
can lead to death in locus coeruleus neurons.
Right.
We have not had direct human evidence of this yet, but there's
Okay.
some indirect evidence. So, people who have had sleep apnea for a long time and have had those what we call intermittent hypoxemia affecting
Yeah.
the brain for a long time, even after you treat them, their sleepiness may not go away. That's because there's damage to the locus. We postulate based on the
Okay.
animal data that there's damage to the locus coeruleus.
Okay. Yeah. So then coming back to this idea of how sleep is different for refugees and people who have been
Mhm.
exposed to trauma, what
Mhm.
what kinds of sleep disorders do you see with them more often, perhaps?
The most common sleep disorder we see is insomnia.
Okay.
in this situation. And usually they may be very tired and they may, fall asleep quickly, but then the sleep is always, light. They're always easily awakened because they've been primed from the fight or flight.
Yeah.
They have multiple awakenings. And then the nightmare disorder they have uh, perpetuates the problem, but by creating multiple awakenings. And during the nightmare, there is an increase in autonomic activity. So there's a surge of noradrenaline. So there's, the heart racing and etc. So that creates a further arousal mechanism and disturbs sleeps further.
Okay. Another thing that I saw, another term I saw that came up in your research is a sleep desert. So I'm curious, could you elaborate on what sleep deserts are and maybe how this relates to like the idea of sleep?
Mhm. So, to understand sleep deserts, I want to explain briefly the well-known concept of food deserts.
Yeah.
So, food deserts are primarily urban neighborhoods that are economically disadvantaged, where people don't have access to healthy food. So their only way to get food from a store is the local mini mart that sells basically junk food.
Yeah.
And in order to get healthy food, first of all, health foods can be unaffordable. I mean, like one walk through Whole Foods, you know how expensive healthy foods
Yeah.
are.
Yeah.
And then they're poor, they may not have a car, they may not be able to go to a grocery store that sells fresh foods and etc. And then, generally speaking, at least in the US, the few cities that have public transportation, for example, Chicago,
Yeah.
the public transportation routes are much denser and much better in the wealthier neighborhoods than in the poor neighborhoods. So they don't have a car, they don't have a local grocery store, they have a hard time finding a public transportation to take them someplace, so they can't get health food. And even if they get there, it's too expensive. So
Yeah.
food desert are these areas where, so we took that concept and applied it to sleep desert. So,
Okay.
the same way that you can tell an obese person living in those food deserts, go eat healthy, right?
Yeah.
That's not that it's easier said than done. Same thing with sleep. Sleep deserts, strictly speaking, are urban neighborhoods where there's too much light
Okay.
because poorer neighborhoods tend to have higher crime, so the city keeps the lights on more to mitigate
Oh,
that.
okay. I see.
The housing is not built as solidly as housing elsewhere, so the walls are thinner. There's too much noise,
Yeah.
and then there's also the temperature control. I mean, if it's
Okay.
too cold, most of these units, the low cost rental units don't have internal thermostats. It's the building controls the heat, and so everything we tell people be in a quiet, dark, and cool room may not be possible for these people.
Yeah. Another thing is I'm guessing there might not be like as many windows too, for instance. Because I know light exposure is a big thing.
Yes, yes,
Yeah.
during the day, there's not many windows. Add to that, there's a fear of going out, having exercise to
Yeah.
help sleep.
Yeah.
So there's a lot of factors that it's beyond their control that they don't have.
Yeah. And I was actually going to ask, when you were talking about sleep deserts, how like maybe temperature could play a role. So I think you already addressed
Hmm.
this, but I
Yeah.
was actually, this is kind of tangential to what you're saying, but I'm
Hmm.
curious, like, do you think that climate change and rising temperatures might adversely affect sleep
Yes.
in terms of, and on population?
There was a
Yeah.
there was a paper that was published in 2021 in the journal Cell, where they looked at over a period of 5 years, they accessed wearable data
Okay.
from I it was something like 60 countries or
Oh wow.
something in that
I see. Yeah.
ballpark number.
Yeah.
Um, and looked at the sleep duration
Hmm.
and compared it to the temperature changes. And over the 5 years, the temperatures were rising. So you can see that the sleep duration overall decreased,
Oh
and
wow.
sleep disturbances increased based on the wearable data.
Yeah.
Because even if the wearables don't have absolute accuracy,
Right.
they have internal consistency.
Ah,
And
yeah,
you're
that's true.
accessing this measurement from the same people, right? You're not
Yeah.
comparing Mr. X with Mrs. Y. It's the
Yeah.
same person over
Mhm.
5 years.
Yeah.
And it showed that with the increasing temperatures, sleep suffers significantly, more so in the middle income countries than in higher income countries. Unfortunately, because wearables are not accessible to low income countries, there was no data from low income countries. It was just
Okay.
high income countries, high middle and low middle income.
Okay. So, coming back to this idea of sleep deserts, what kind of like ideas for interventions do you kind of like see potentially developing over the next like years to kind of address this in these inequities that we're seeing?
Yeah.
Yeah.
So first of all, you need to have buy-in from the municipalities in these cities because you can't just partner with private firms who are building houses and they care about how much money they're going to make from it.
Right.
And some of these modifications are pricey, and that will put the cost of the housing out of reach for these people. So you need municipality involvement.
Yeah.
And there is data to show from Europe that you can actually improve sleep by insulating walls.
Oh,
And they compared. They did. They had people in buildings for low income. Uh, I think it was in Northern Europe. It was either Denmark or Norway.
yeah.
So they took buildings and they did the quote unquote placebo.
Okay.
So some of the units they went in as if they're putting insulation, but they didn't do anything.
That's funny. Yeah.
While the others they did
Yeah.
insulation,
Yeah.
and then they compared, and
Yeah.
sleep significantly improved with reduction in noise. So
Oh, wow.
that's the one study that's directly related to this.
Interesting.
There are indirect studies with light.
Okay.
So there is a sub specialty of architecture that deals with health and particularly sleep. And the and you if you build windows facing in a certain direction, you ensure that people who are in nursing homes, especially those with
Uh,
slight cognitive impairment, do much better.
someone did mention this actually in a
Yeah.
previous interview. That's
So
interesting.
you can easily
Yeah.
uh, uh, um, uh, translate this
Yeah.
to a sleep desert, right?
Yeah. Yeah.
And then lastly, there is no, I mean, no real world data on this, but there is a study from Greece um, where in a journal called, I think, Environmental Engineering, where they were able to find affordable ways to insulate walls against excesses of temperature.
Okay. Yeah. I think we both know that temperature plays a big role in terms of like sleep quality. So that's definitely
Absolutely.
fascinating.
Yeah.
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 So actually, I just interviewed someone before this interview at just an hour
Hmm.
ago for me. So and we were talking about how sleep apnea is often underdiagnosed very often. So I'm curious,
Hmm.
like, how do you see like untreated sleep apnea present in these like refugee populations, for instance?
So we haven't had the chance to fully investigate that.
Okay. Yeah.
Because we don't have any ways of testing yet, because it's a shoestring budget,
Okay. Yeah.
basically. But with the further crowding, in a smaller spaces, more people are witnessing others snore or
Yeah.
stop breathing and
That's true.
etc.
Yeah.
Yeah, but access to treatment is difficult, because you have to not only have a CPAP machine, then you have to have access to changing those supplies and so forth. Um,
Yeah. Yeah. So, what are some of those like barriers, I guess, people face with like for example, CPAP adherence or getting like
mhm.
that treatment for those like sleep disorders in general, I guess, for instance, or just
Yeah.
sleep apnea. Yeah.
So overall treatment barriers are cost and
Yeah.
availability,
Yeah.
right? I mean, the gold standard for treatment for insomnia is cognitive behavioral therapy.
That's true.
And it's hard to find cognitive behavioral therapy providers
Yeah.
in in the West, in the wealthy countries, let alone ones that in the
Yeah.
poorer countries.
Yeah.
And then there are certain things that they advise them to do that may not be doable if they're living in a camp under a tent, for example, right?
Yeah.
The other thing is awareness of the need to treat and accessibility of treatments, and the way to deliver the treatment. We have a small program here where we look at migrants and asylum seekers, and we try to deliver uh, uh, telemedicine-based cognitive behavioral
Oh,
therapy.
yeah.
And we've seen many, many barriers, but the ones who went through have uniformly had significant improvement in their sleep.
That's good. Yeah.
And the barriers are the providers who are taking care of them are all volunteers. They're stretched thin.
Yeah.
Um, and then um, they don't know maybe about the availability of this service, for
Okay.
instance.
Yeah.
And then the patient doesn't necessarily, they don't have the same level of health literacy somebody who's born and raised here does. They
Yeah.
don't understand, why this person's calling,
Hmm.
etc. So there are various issues there. As far as medication, um, medications are expensive and not easily available, and then medications, the effects wear off easily, after a while. So the ones that have a better efficacy and safety profiles are so expensive that it's even inaccessible to a lot of American citizens who are
Right.
born
Yeah.
and raised here.
Yeah.
As far as the sleep apnea, I mean, the treatment is usually a device,
Yeah.
right? So they have to carry the device with them. They have to have access to a medical equipment provider to make sure that they change the supplies every 6 months, like the mask and the hose, etc.
Yeah.
You have to have access to distilled water,
Okay.
because if you put drinking or tap water, if you put tap water, it can contaminate things. If you put drinking water, like purified water, it will still have enough minerals in it to create a layer like a cake of
Oh,
white crust
yeah. I
that
didn't
may
realize
damage the
that.
machine.
Oh,
Yeah.
wow. Yeah.
So there's a lot of limitations there.
Yeah. Yeah. Do you think that like home sleep testing could offer like some benefits?
Oh,
Especially, yeah,
absolutely. Absolutely. Home sleep testing can offer a lot of benefits because you can study more people faster.
yeah,
And the more than home sleep testing in these situations, certain wearable devices, if
mm,
people can afford to have them,
yeah,
have pretty good accuracy
yeah,
in detecting sleep apnea. I mean, they cannot maybe assess the severity of sleep apnea, but in a pinch, they show you, yes, high suspicion of sleep apnea, they have the symptoms you can treat.
yeah. That's fascinating. Um, so when clinicians are like evaluating, for instance, or like screening, for example, like trauma exposed patients, what are some things that like you would predict like they're looking for? I guess like maybe symptoms or because I know we just talked about like
Yeah.
the like wearables helping in terms of getting them to
hmm
that like clinician. But then what is like the clinician doing, for instance, like in terms of like what are they looking for, I guess.
So I guess what's the reason for difficulty sleeping? Is it not able to turn off your mind? Is it something waking you up at night? Is it the memories
Okay.
or the nightmares from the trauma waking you up? And there are screening questionnaires that can be used
Okay. Yeah. Yeah.
that work very well. And then you can, it's for nightmare treatment, you don't need to be necessarily a PhD level psychologist.
Okay.
Social workers, case workers, nurses can learn the techniques to treat nightmares.
Okay.
Then there are very useful handbooks translated to English, originally written in French,
Yeah.
that teach you steps, basically restructuring the nightmare content, and it works for majority of people.
Yeah.
Um, and that could be one element of getting rid of things, getting rid of this disturbance in sleep and in the insomnia, and then the rest. I mean, we do use sometimes certain medications that are inexpensively available,
Yeah.
but in our research, we've shown that medications temporarily in the short term may alleviate the anxiety of not sleeping, even though in the objective testing, the sleep did not improve significantly.
Like a placebo effect, perhaps, or
Perhaps placebo effect, or perhaps they have an anti-anxiety component,
oh, okay.
or the other thing is that because they're sedating, they cause amnesia of having been awake in the middle of the night, even
Oh,
though
okay.
on
Interesting.
polysomnography you see that awake. Yeah,
Yeah, okay, that's interesting. Yeah.
yeah.
Um, so if you could like give tips for people like living in a sleep desert, for instance, like what would
hmm
some of those be? Because obviously like speaking with the municipality is like a very
hmm
long process. Like let's say someone isn't able to take like large scale like population,
hmm
which would be hard for especially someone who might be like watching this episode and is like, hey, maybe I'm living in like somewhere that has some of these
hmm
like difficulties and barriers for
hmm
me to get sleep. What are some tips you'd have for them?
I mean, you can always easily buy eye covers
Okay.
for
Yeah.
uh, um, the darkness,
Yeah.
earplugs for the noise.
Hmm.
They're relatively inexpensive. You can buy a small fan for the hot days to make
Yeah.
it cool, at least circulate the air
Yeah.
if there's no problem with electricity. So those are some of the basic measures people can take. Uh,
Interesting.
there was a uh, there was somebody who contacted me, and she had invented this little half a tent that people can uh, put on their head and torso at night. and
Oh.
it creates total darkness.
Oh wow, that's interesting. Okay. Yeah. That's a cool idea.
So measures like that, yeah.
Yeah, yeah, yeah. So, looking ahead in terms of like the research side of things, what kind of questions about sleep, or just like in terms of the population too, what kind of like questions are you looking to answer, excited about approaching?
So one of the things that would be interesting is to find ways of reducing the impact of nighttime light on people.
Oh,
Uh,
okay.
so even if you eliminate the uh, factor, the factor of having 24-hour access to shopping and computers and internet and TV,
Yeah.
even if you eliminate that, if you say, you know, uh, person is very conscious of everything they're doing, they are, turning off their phones, etc., etc. The amount of illumination that there is outside does impact people's sleep.
Wow.
And overall, we sleep a little less than our ancestors did because of this.
Yeah. Yeah. That makes sense. What are some like approaches you like are thinking about potentially, like in terms of this kind of question?
So one of the things that could be, again, you need buy-in from
Yeah.
uh,
Yeah. Oh, yeah.
stakeholders in a
Yeah. Yeah.
community or a city. You can still have the light, but you can make it,
Like,
you can filter out the blue and green
okay.
wavelengths, the
Yeah. That's what
shorter
I was actually
wavelengths.
thinking. Yeah.
Yeah,
That
yeah.
makes sense. Yeah.
About 20 some years ago, I consulted with a prisoners' rights organization
Oh, wow.
at the maximum security prison in Vermont, where they had to have the lights on all the time.
Right. Yeah.
And they were not able to sleep, and it's creating problems. So we substituted at night the white lights with orange light, orange and red light. So
Yeah.
the guards could still see, there's still security,
Yeah.
but at the same time, the prisoners can sleep.
Yeah. That's creative. That's cool that
Yeah,
you're able to contribute to that.
yeah.
Yeah. On that note, Dr. Tarian, thank you so much for joining me today. It's
Oh,
fascinating to
thank
talk
you for
about.
inviting me.
Yeah. Thank you.
Okay, take care.